Hi, everybody. There's one amputation every 30 seconds due to a chronic wound. Cost of wound care is phenomenal. In the US alone, it costs $25 billion. Globally, it's more than $100 billion. It costs so much simply because chronic wounds do not heal very quickly. They take months or sometimes years. Underlying causes are diseases that you see there, especially like diabetes, with growing numbers of patients around the world. The problem with managing a chronic wound is the systemic problem itself that in many cases ends up prolonging the wounds. This is how it's being done in a hospital. You'll find it very archaic, but this is how it's being done. That's a trained nurse that you see there. She's called a wound nurse. She probes the wound to see how deep it goes. That's called undermining. And she measures it with tape, and she marks it to show exactly how deep the wound goes. It's highly inaccurate, and there's a huge error rate as well. And next problem will be when the patient moves from the hospital to a nursing home and home care and personal care. Information gaps create more problems. Thereafter, there's a stretched resources, shortage of nurses globally. The whole system needs something that's automated from end to end, and that's where we come in. KroniKare AI-based system, we are a fully integrated system. The front end runs on a normal smartphone with an embedded machine learning running on our phones and with an infrared attachment that's off the shelf. We are really fast, less than 30 seconds, automatic, accurate, and let's see what we do. We can do an automatic 7-tissue type segmentation automatically. What takes a nurse a couple of minutes to do, we can do it automatically at pixel level accuracy. We can do a wound size measurement automatically as well. We can check for complications. For undermining wounds, we use infrared to actually see what the problem is, and we can check for blood circulation problem as well. Look at the toes. They are getting gangrene when the nurse won't see it with the naked eye. And the next problem is preventive of pressure ulcers. That's a huge problem in hospitals. We can detect where a pressure ulcer might be forming. They can take steps to elevate it to make sure that it doesn't break out. And we send all of that on a report to the backend that just saves them all the manual recording they've been doing. So from this, 30 minutes all the way down to just 30 seconds, that too, we free up the wound nurse, and the junior nurse can do it. The wound nurse just sees the data from a screen itself. It frees up the time. KroniKare is a complete solution, front end on a smartphone, reports on dashboard, and wound data on cloud. On the cloud itself, you can see the tracking, predicting, and case matching of cases. The first benefit is the manpower itself. Huge productivity gains. We free up the wound nurse, and we upskill the junior nurses to actually do the job itself at the bedside. Thereafter, we get better patient outcomes with the continuous care, because this system can follow a patient from each continuum of care from one setting to another. That's faster recovery. And the third benefit is that digitalization. It's a nurse workload reduction and accurate records to prevent lawsuits. Fourth benefit, the downstream, there's huge saving on wound dressings, healing prediction, discharge planning. They can plan the patient's discharge from a hospital to a community hospital and home. This is what the market is right now. There are a few companies which have tried to do 2D and 3D analysis, and some using AI-driven technology, but the missing ingredients are complication detections, and that you see all of that. Thank you very much. We are doing very well in Singapore, and we hope to see all of you again soon. Thank you.